Hi, Joe. Hi, Eileen. So we're going to get started with our conversation today with just some introductions. If you could both tell me who you are, what your role is, and a little bit about what you do day to day.
Sure. Well, I'll start. I'm Joe Bradley. I'm the data manager and improvement specialist here at the network. And one of my big jobs is collecting and curating the regional data for our 16 county region. And so that's going to lead us into Eileen here.
Yes, so I was a graduate intern with WNC Health Network before I graduated with my Master of Public Health degree in August. Day to day, I worked with data, looking at substance misuse in emergency departments in Western North Carolina.
Eileen, how did you first hear about the health network?
Yeah, so I actually moved to the Asheville area recently, and I was looking for ways to get involved in the community and also meet the requirements for my capstone project so that I could finish my program. And I found WNC Health Network. I thought they would be a great fit, especially because of the focus on health disparities. And I also really wanted to learn about regional initiatives. In school, you talk a lot about national or state or community level health data, but not a lot about regional work. So I thought that would be really interesting.
Great. Well, we've been happy to have you. Let's talk a little bit about the research that you did. Love to hear about it.
Yeah. So when I signed up, I knew that I wanted to do something that maybe I could contribute some new or useful information to the region. So in order to do that, I needed to learn about regional health priorities, which Joe can actually talk more about.
Absolutely. Let me go ahead and share my screen here. And what you should be seeing is a chart of our regional health priorities for the 2021-2023 CHA cycle. And you'll notice that many of our counties identified substance misuse, mental health, followed by obesity, healthy eating, active living, and nutrition. And so when we were deciding where we really wanted to start with this project, we went to the one that was selected by the most counties here in our 16 county region, 16 counties, 17 communities. And that would be substance misuse. So we started there, and then Eileen can tell you a little bit more about how we kind of dug into exactly what we were going to study.
Yeah, so so of course we chose substance misuse. It's a very pressing issue, and based on some research that's already been done, I learned that polysubstance use, or using two or more substances at the same time, is becoming more important. But we really haven't had the data to study it very well. North Carolina Department of Health and Human Services recently added polysubstance misuse as a priority of the state's opioid and substance use action plan. And we had emergency department data. We knew that substance misuse was a driver of emergency department visits. We just didn't know whether there were differences between people who were using a single substance going to the emergency department and people who were using two or more substances. So for our analysis, we compared those groups. We also looked specifically at people who were using opioids, cocaine, or psychostimulants. So psychostimulants are things like methamphetamines, and those were again based on state local priorities.
And who did you have any other partners for this research that you did?
We did. We worked with Dr. Jennifer Runkle, who works at North Carolina State University. She's an environmental epidemiologist. She served as a subject matter expert and helped us facilitate that data, provide some technical guidance.
Great. So what were some of your high-level findings?
Yes. So
Right here. Got it?
yes. So what we did find overall was that polysubstance misuse it is increasing in the emergency department for residents of Western North Carolina. Overall, we found that between 2016 and 2020, there was a 5% increase across those 5 years. If you can go to the next slide. And we also found, interestingly, that rural residents were coming into the emergency department visit more for polysubstance misuse over time. So you can see on the graph that between 2016 and 2019, there was an increase in 5% of people coming in using 2 or more substances from rural areas. But if you look between 2019 and 2020, interestingly, there's another 5% increase. So you see that pretty big uptick. The next slide. We also saw that compared to emergency department visits for opioids and cocaine, psychostimulant related emergency department visits were on the rise. It doesn't necessarily, that's not a general finding about substance misuse in general in the community. That is the percentage out when you compare to opioids and cocaine. Next slide. And then overall, we saw that percentages of opioid and psychostimulant emergency department visits nearly doubled for patients reporting as Black or African American who were residents in Western North Carolina. And next slide.
Did you say next slide?
Yes. And lastly, we also looked at some other characteristics of the patients coming into the emergency department. So compared to individuals who came in for a single substance, Western North Carolina residents coming into the emergency department for polysubstance misuse were more than 26 times as likely to have a diagnosis of a mental illness, 76% more likely to come in with suicidal ideation or behavior, and we did control for intentional overdoses in that data. They were also 2 times more likely to have housing or economic problems. We found some specific differences in individuals coming in using cocaine or psychostimulants. So individuals using cocaine were more than 6 times as likely to have a mental illness. And patients coming in for psychostimulant use were more than 4 times as likely to have a mental illness. They were also more likely to have housing or economic problems. And this was the group that was most likely to be living in a rural county. Next slide. Okay, and then just a quick summary. Basically, we wanted to share what providers can do with data like this, some of this data that's available. So hospitals and emergency services can use the data to better understand who are coming into their emergency departments. They can get important demographic information about the types of individuals who are using specific substances when they come in. Researchers, epidemiologists, and analysts can use data to focus on regional analyses, which is so important. We have a lot of state and national level analyses, but they maybe don't share insights that are specific to an area. They can also study polysubstance misuse. Again, this is a topic that more and more people are talking about, but it can help influence funding policy and programs. Substance misuse programs can also make use of data that can help them better understand who are coming into the EDs so they can better prepare, maybe when they make referrals. And informaticists. So those are folks who use data, information, and knowledge to improve human health and healthcare delivery. They can help make data more accessible so that these groups who may not have the expertise or may not have an easy way to get this data, they can help facilitate that.
Thank you so much for that high level overview of the research that you did. how it can be used in our region and for people who are doing this kind of work. Joe, I'm curious, how did this project align with the kinds of data projects that we do at the Health Network and our values for how we work with data?
Sure. So for clinical data has long been a data gap for our region, and being able to look at it kind of at this regional level, that means all the facilities information at one time. And so when we found this opportunity to work with Eileen, who was really interested in hospital data, and work with Jen Runkle, who's an amazing epi in this region, and had access to the data, we saw it as a perfect way to kind of dip our toes into the water of clinical data and looking at regional data that way. And we know it's something that people have been wanting for a long time, have been requesting, and we started with the most important health priority across our region. So that's just one way that we're trying to give back to the region.
And Eileen, what was your experience like working with the Health Network on this research project?
I had a very easy time. I got to work closely with Joe, who was just super responsive and gave me a lot of guidance. So it was a great experience. And, you know, it was a combination of working together and working independently. And I just learned a ton, especially about the region and community health.
And I think about working with hospital data too. That was, there's a lot of things that I learned as well about what needs to be in place to work with hospital data, and then all of the analyses that went into that.
Yes.
So what's next for you, Eileen?
So I'm continuing to dig in a little bit into this data because we want to make sure it was very time limited to get it done for my school project. But we're continuing to work on that. And also I'm looking for my next role in public health. So I'm very excited. I just got my degree. So I'm looking for opportunities in community health that will help me make use of my research background and my new skills.
Awesome. We can't wait to see what you end up doing and hope it's in our region. Joe, I guess on a final note, how can people find out more about the WNC Health Network's data and data program?
Sure. So of course, the best place to start is our website, and we have a specific data section where you can download our full regional data set. So that's our primary and secondary data that was just updated last month. So you've got the latest, greatest data there. You can also sign up for our newsletter so that you keep getting information about data releases. We've got a lot of really good stuff that's going to be released over the next year. And then of course you can always email me. So if you're interested in getting involved or learning more about Eileen's data, you can email me at joe.bradley@WNCHN.org.
Great. Well, thank you so much for sharing about this project, and yeah, great work.
Thanks. Bye.